Okay, so you've brought this really interesting clinical guideline to our attention for this deep dive
Yes.
from the American College of Physicians.
Yep.
And it's all about preventing episodic migraines.
Absolutely. And you know what's really striking is just how big of a problem migraines are.
Right.
The guideline actually points out that migraine is the second leading cause of disability for all adults globally.
Wow.
And it's the top cause in women between 15 and 49 years old.
Yeah, that's huge. And those are like prime working years.
Exactly. It's a massive problem. And
Right.
it really impacts people when they're trying to be productive and live their lives to the fullest.
For sure. And here in the US, it's no different. I mean,
Right.
it affects about 16% of the population.
Wow.
And like you mentioned, it disproportionately affects women, younger adults from 18 to 44, folks who are unemployed, and people with lower incomes.
Yeah, it really highlights the disparities that exist
It does.
and how certain groups are much more vulnerable.
Totally. So it's definitely not just a minor inconvenience, right? It's something that has major implications for people's lives.
Absolutely. And the economic burden is enormous.
Oh, yeah.
The guideline cites over $78 billion annually in the U.S. alone
Wow. That's a lot.
for medical expenses and lost productivity.
Yeah. And that's not even considering all the ER visits and doctor's appointments that people make because of migraines.
Exactly. It's a huge strain on the healthcare system
Mm-hmm.
and, of course, a major disruption to people's daily lives.
So essentially what we're focusing on today in our deep dive is prevention, right? As outlined by the ACP. And this means looking at strategies that can help reduce how often these migraines occur and how severe they are when they do.
Exactly. And ultimately, the goal is to improve your overall quality of life.
Right. To help you function better and really live a more fulfilling life.
Precisely. And what I find really interesting about this guideline is that it recognizes that despite the prevalence of migraines, they're often underdiagnosed and undertreated.
Mm.
There are people out there who could benefit from preventive medication, but they're not receiving it.
That's really concerning.
It's a significant gap in care that needs to be addressed.
Definitely. So the guideline goes on to outline the different types of medications that can be used for prevention.
Yes.
And some of these were initially developed to treat other conditions like high blood pressure or depression
Right.
and are used off-label for migraines.
Exactly.
So that means they weren't specifically approved for migraine prevention,
Correct.
but doctors might prescribe them based on their clinical experience and emerging evidence.
It's important to have a conversation with your doctor about the risks and benefits of using medications off-label.
Totally. And then, of course, there are those medications that are specifically FDA approved for migraine prevention,
Yes.
which includes some of the newer therapies like CGRP antagonists and monoclonal antibodies.
Exactly. These newer medications work by targeting a molecule called CGRP,
CGRP.
which plays a key role in migraine attacks.
Got it. So how did the ACP actually develop these recommendations?
Well, they conducted a very rigorous review of the research,
Okay.
looking at how well different medications work and what their potential downsides are.
So they're really trying to get a comprehensive picture.
Exactly. They also considered patient values and preferences,
Of course.
as well as economic factors,
Yeah.
using a method called GRADE
Great.
to assess the evidence and make recommendations.
Makes sense. And what's important for you to know
Yes.
is that all three of their main recommendations
Right.
are conditional, meaning the evidence isn't totally definitive.
Right. And they're based on low certainty evidence.
Okay, so let's break down what these recommendations actually are.
Absolutely.
So for individuals who are thinking about preventative treatment,
Yep.
the first thing the guideline suggests is starting with what they call monotherapy,
Monotherapy.
which means using just one medication at a time.
Exactly one medication to start.
And they recommend beginning with one of four options. These include a beta-adrenergic blocker, specifically either metoprolol or propranolol,
Right.
the anti-seizure medication Valproate,
Uh-huh.
a serotonin and norepinephrine reuptake inhibitor known as venlafaxine,
Okay.
or the tricyclic antidepressant amitriptyline.
So those are the initial options.
Yeah, and it seems like they're prioritizing those more established and affordable medications as a first step.
Exactly. They're generally well tolerated and have been used for a longer time.
Right, but it's important to understand that the evidence supporting one over another isn't particularly strong.
That's correct. The studies haven't shown a clear advantage of one medication over the others.
Okay, so what if those initial treatments don't provide enough relief?
Yeah, what happens then?
Or if someone experiences intolerable side effects?
Well, that's where the second recommendation comes in.
Okay.
The ACP suggests trying monotherapy with either a CGRP antagonist Gepant,
CGRP antagonist Tripant, right?
such as a Tojepant or Rimegepant,
Okay.
or a CGRP monoclonal antibody.
Like those newer ones we talked about.
It's exactly like eptinezumab, erinumab, fremanezumab, or galcanezumab.
So these are sort of the second-line options?
Yes, if the initial treatments aren't successful.
And then as a third-line option,
Right.
after trying the first-line treatments and the CGRP antagonists or monoclonal antibodies,
Right.
the ACP suggests considering monotherapy with another anti-seizure medication to pyramid.
Exactly. So it's a tiered approach,
A tiered approach.
moving from more established to newer therapies.
I see. And what's the rationale behind prioritizing the treatments this way?
Well, the key factor is that the evidence didn't conclusively show that one treatment was significantly better than another in terms of overall benefit.
So there's not like a clear winner.
Not really. And because of this uncertainty, economic considerations and patient values played a big role in shaping these recommendations.
Makes sense, especially given that the certainty of the evidence is low across the board.
Exactly. But the guideline does highlight a few instances where some differences in outcomes were observed.
Oh, really? Like what you...
For example, it mentions that beta blockers and CGRP monoclonal antibodies might be associated with fewer people stopping treatment due to side effects compared to topiramate.
Interesting. So they might be better tolerated.
Potentially. And there's also some indication that CGRP monoclonal antibodies might be better at reducing migraine frequency and the need for acute medication compared to topiramate.
Okay.
They might also be better than valproate at reducing migraine frequency,
Interesting.
and venlafaxine might reduce migraine duration compared to amitriptyline.
So there are some subtle differences.
Yes, but it's important to remember that the certainty of this evidence is still low.
Right.
And for many other outcomes, there simply wasn't enough data to draw firm conclusions.
So more research is definitely needed.
Absolutely, and we'll get to that later.
Sounds good, but let's talk about cost for a second, because that seems to be a significant factor here.
Oh, absolutely. The guideline really emphasizes the higher cost of CGRP antagonists, GLPs, and CGRP monoclonal antibodies
Compared
to those medications recommended as initial treatment options.
Right, like metoprolol or amitriptyline.
Exactly. Those are much more affordable.
So is that the main reason why the ACP recommends starting with the less expensive alternatives?
It's a major factor. They want to ensure that people have access to effective treatments that are also affordable.
That's really important, especially considering the economic burden we talked about earlier.
Exactly. It's about finding a balance between effectiveness and affordability.
For sure. The guideline also mentions patient preferences, noting that many people prefer taking a pill over getting an injection.
Yeah, that makes sense.
Which is how some of those CGRP monoclonal antibodies are administered.
Right. And they also highlight that for some patients, the benefit of having fewer migraines might outweigh the concern about potential side effects.
So it really comes down to individual needs and priorities.
Absolutely. It's about having a conversation with your doctor and figuring out what's best for you.
Okay, so let's talk about adverse events or side effects.
Sure.
The guideline says that the side effects vary depending on the medication, but most are generally mild.
Yes, that's generally the case.
But they specifically mention that topiramate was associated with a higher number of reported side effects.
Right.
Which is interesting because that seems to be a key reason why they suggest trying some of the other less costly options first.
It makes sense. If a medication has a higher risk of side effects, they'd want to explore other options first.
Totally. So this really underscores how crucial it is to have a conversation with your doctor
Absolutely.
about the potential side effects of any medication.
Definitely you need to be informed and weigh the risks and benefits.
Right. And it's also worth noting that there were some treatments that didn't receive recommendations.
Oh, yes.
These include ACE inhibitors like lisinopril, ARBs like candesartan and telmisartan,
Right.
and the SSRI fluoxetine.
Okay. Why is that?
The reason is that there weren't enough studies directly comparing these medications to other migraine prevention treatments.
So not enough evidence.
Exactly. Or the evidence that did exist wasn't strong enough for the ACP to make a confident recommendation. I see. So while there might be some anecdotal evidence or smaller studies suggesting they could be helpful,
Right.
the overall data wasn't robust enough.
Exactly. More research is needed to determine their effectiveness for migraine prevention.
Okay, so let's shift gears a bit and talk about some of the clinical considerations.
Sure.
The guideline really stresses the importance of identifying and addressing those modifiable migraine triggers.
Yes.
And encouraging healthy lifestyle changes.
Those are the foundation of migraine management.
Right. Things like staying hydrated, getting enough sleep, managing stress,
Right.
and engaging in regular physical activity.
Exactly.
Yeah.
All of those things can contribute to reducing migraine frequency and severity.
And they also emphasize the importance of making sure you're using those acute migraine treatments effectively.
Absolutely. You want to make sure you're taking the right medication at the right time.
Right, so you're not suffering unnecessarily.
Precisely. And it's interesting because the guideline acknowledges that there aren't always clear-cut rules for when to initiate preventive treatment.
That's true. It can be a bit tricky.
Yeah, they suggest considering it if you're experiencing debilitating headaches despite using acute treatments.
Okay.
Or if you're intolerant to acute medications or using them too frequently.
So it's a judgment call based on individual circumstances.
Exactly. You need to discuss it with your doctor and figure out what's best for your situation.
And once you start a preventive treatment, it's crucial to stick with it, right?
Absolutely. Consistency is key.
It can take time to see the full benefits, sometimes a few weeks or even a couple of months.
That's right. So don't get discouraged if you don't see results immediately.
Patience is key, and the guideline also reiterates the importance of considering those economic factors.
Yes, affordability is crucial.
And having that open conversation with your doctor about your financial situation and preferences.
Exactly. It's partnership.
Right. And they even suggest that if the initially recommended treatments don't work,
Yes.
it might be worth trying those medications that didn't get formal recommendations.
Right, like the ACE inhibitors, ARBs, or SSRI.
Exactly. So there are still other options to explore.
Absolutely. And they also include important cautions about using these medications in women who are pregnant breastfeeding or of childbearing potential.
So safety is always a top priority.
Always, especially in those situations.
And in terms of practical advice,
Yes.
they recommend starting with a low dose of medication and gradually increasing it until you achieve the desired effect.
And monitoring for side effects, of course.
Of course. And they suggest giving each treatment a trial period of about 2 to 3 months before considering switching to something else.
Makes sense. Give it some time to work.
Exactly. And they also highlight the value of keeping a headache diary.
Oh, that's a great tool.
It can help you track how often your migraines are occurring, how severe they are, and how well your treatments are working.
Exactly. It provides valuable information for you and your doctor.
Right. It can really help you understand your migraines better.
Absolutely. And remember, medication isn't the only approach. The guideline mentions behavioral interventions like cognitive behavioral therapy, relaxation techniques, and mindfulness practices.
So it's a holistic approach.
Exactly. These interventions can complement medication and help you manage stress and triggers.
It's about finding what works best for you and your individual needs.
Precisely. And the guideline reinforces the importance of prescribing those less costly medications when they're effective.
Right, because cost is a huge factor for many people.
Absolutely. It's about providing accessible and affordable care.
Definitely. And speaking of research, the guideline also acknowledges that there are still gaps in our knowledge.
So yes, there's still a lot we don't know about migraines.
They point out that there haven't been many head-to-head studies comparing different migraine prevention treatments,
Right.
which is a major reason why the certainty of many findings is currently low.
Exactly. We need more research to get a clearer picture.
And they also call for more research on patient-centered outcomes.
Yes, things like quality of life and how treatments impact daily functioning.
Right, those are the things that really matter to people.
Absolutely. And they also emphasize the need for more research on cost effectiveness
Of course.
and how treatments affect different subgroups like different ages, races, and ethnicities.
So really getting a more nuanced understanding.
Exactly. And it's interesting that they point out the lack of data on things like physical functioning and emergency department visits.
Yeah, that would be valuable information.
It could help us understand the full impact of migraines and how to best manage them.
So let's bring all this together for our listeners.
Yes.
The key takeaway from this deep dive into the ACP guideline is that it provides a framework for preventing episodic migraines.
Right. Starting point.
Exactly. And they generally recommend starting with those more established and less expensive medications,
Yes.
with the newer CGRP targeting drugs as options for those who don't respond to the initial treatments.
Correct. It's a stepwise approach.
But it's crucial to remember that these are conditional recommendations,
Absolutely.
and the evidence is still somewhat uncertain.
Yes, and that highlights just how complex migraine management can be.
Right, there's no one-size-fits-all solution.
Exactly. And that's why it's so important for you to have an informed and open conversation with your doctor.
Definitely.
Discuss the potential benefits, the potential harms, and the costs of different treatment options.
And consider your individual health situation and preferences.
Precisely. It's about finding what works best for you.
Exactly, and this brings up a really interesting question for you, the listener.
Yes?
Considering the huge impact that migraines can have and all the advancements happening in treatment,
Right.
what other questions do you have about managing this condition?
What more do you want to know?
What kind of research would be most valuable to you as you navigate your own migraine journey?
It's an important question because ultimately it's about empowering you to take control of your health.
Absolutely, and to advocate for the research and treatments that will make a real difference in your life.
Exactly. Your voice and your experience matter.
So keep asking questions, keep seeking information, and keep advocating for better migraine care.
It's a journey, and we're all in this together.
Thanks for joining us for this deep dive, and we'll see you next time.
See you then.